Welcome back to Medical Arabic. Firas Abu Khatir here. Today we'll be discussing common cardiac symptoms that Arabic-speaking patients present with regularly. This video will help you get familiar with those symptoms and understand common patient phrases as well. In this channel, we use what could be described as a white dialect, which is a blend of different dialects universally understood by most Arabic-speaking patients. So now, let's get started. All right, so common cardiac symptoms. These are the symptoms that we will be talking about today. We're going to be starting with chest pain, palpitations, shortness of breath, leg swelling or edema, fatigue, and cough. So, chest pain. This is going to be a very common symptom that medical professionals are going to encounter, whether that is in the ER, at the clinic, or at the hospital, whether you're on the admitting team or any different team, you're going to be faced with chest pain. So, pain, remember from the past videos, we talked about pain, and you could say pain as waja', waja', or alam. Alam. If the patient wants to say chest pain, you're going to be saying pain in the chest. So in the chest, in is bil, then chest is صدر. So this is going to sound like وجع or ألم بالصدر. وجع or ألم بالصدر. Now, there are a lot of presentations for chest pain. It could be radiating to the back, it could be radiating to the shoulder. So, radiates, if a patient wants to say radiates or you want to say radiates, you say بيمتد, بيمتد. Now, to the is lel. To the is lel. Now, if you want to say radiates to the back, we mentioned that before, it's ظهر. The shoulder is كتف. So we want to say radiates to the back بيمتد للظهر. بيمتد للظهر. Now if you want to say radiates to the shoulder, you say بيمتد للكتف. بيمتد للكتف. Moving on to palpitations. Again, very common symptom that could be described by patients in many different ways and could be asked by the physician or the medical student in also many different ways. He decided to specifically select this specific way of saying it because it's very common to hear and it's very common to understand between Arabic speaking patients. So, palpitations is خفقان بالقلب. So let me just talk a little bit about each part of this phrase. So خفقان is the act of beating. Bil is inside, and then qalb is the heart, as we discussed before, or qalb. So we're saying there's beating in the heart, or that is what is referred to as palpitations. So خفقان بالقلب. خفقان بالقلب. Now, common patient phrases that they're going to be referring to palpitations in many different ways. Sometimes they could call it, my heart is beating fast. They could be saying it in many different ways. So, one of the most common ones is, my heart is beating fast. So, my heart, قلبي, is beating fast. بدأ بسرعة. So بدأ is beating. And that's also another way of saying خفقان. So خفقان goes more to MSA or Fusha. بدأ is more like a dialect or something that is naturally said. So بسرعة is fast. So that would be قلبي بدأ بسرعة. قلبي بدأ بسرعة. Shortness of breath, again, very common. For shortness of breath, you say ضيق في التنفس. So ضيق is like tightness. Fi is like in, and then al-tanaffus is breathing. So ضيق في التنفس. ضيق في التنفس. Now, they could be telling you it's worse when they're laying flat, it's worse with exertion. So if you're trying to say when you lay flat, you say لما بتنام for male, بتنامي for female, على ظهرك for male, ظهرك for female. So لما بتنامي is, or لما بتنام is when you sleep. على is on. ظهرك, ظهرك. We should be able to know that by now. It's the back. So لما بتنام or بتنامي على ظهرك or ظهرك. If you want to say with exertion, you can say مع أي مجهود. So مع is with, أي is any, مجهود is exertion. So مع أي مجهود. Cough, also common cardiac symptom, could be respiratory, could be cardiac. Usually when it's cardiac, it's probably patient is saying, "Oh, I cough usually at night. I can't stop coughing at night." So cough is سعلة or كحة. سعلة or كحة. Whichever is easier for you. Those two words are universally understood by Arabic speaking patients. At night, في الليل. So fi is at or in, الليل is night. So a common patient phrase that you're gonna encounter is I get the cough at night. السعلة or الكحة بتيجي في الليل. تيجي is comes في الليل at night. So السعلة or الكحة بتيجي في الليل. Like swelling or edema. انتفاخ في الرجلين. انتفاخ is swelling. في is in. الرجلين, we talked about that before, are the two legs. So انتفاخ في الرجلين. A common patient phrase that you might also encounter is my shoes don't fit anymore. And that would be said in a way, so they could be saying الأحذية صارت ضيقة. الأحذية, the shoes, صارت, became ضيقة, tight. So that's a way of saying my shoes don't fit anymore. That's very common with English speakers, but the way that the Arabic speaking patient is gonna describe that is the way that I mentioned. So الأحذية صارت ضيقة. Now fatigue, that could be for a lot of different reasons. Could be cardiac, again, we mentioned probably with exertion. Fatigue is تعب. A common patient phrase that you're gonna get is I get tired quickly. بتعب بسرعة. بتعب بسرعة. So this is the end of this video. Thank you so much for watching. Please make sure to subscribe to our channel, like this video, share it with others, and please, please, please comment with any questions or suggestions for future content. We take your comments very seriously, and we're always willing and hoping that we can improve our content. Thank you.